Hi, welcome to another episode of Talking with Dr. Donna. It's Thursday. It is the time when you have an appointment with your doctor. And so here today on Talking with Dr. Donna, we are going to discuss children and coronavirus. I'm going to give you a little bit of updates, and I'm going to talk to you about quarantining because it is extremely important that you understand quarantine. As you know, my goal is to be your trusted source because I want to build generational health for our community. That means one person at a time, we develop the best health that we can be in to help successive generations. So I'm going to start. I'm going to share my screen. So bear with me. I'm going to share the screen and we're going to talk about coronavirus. I'm going to give you some updates. I'm going to talk to you about what you need to know and what we already know. So I'm going to start here and we're going to talk about coronavirus. All right, so here we go. Now, we already know this, right? How to prevent coronavirus. This is really important. I'm going to come back to this slide in a little bit, but I want you to see right now why it's important. You know, we have to stay apart from each other. We have to wear a mask and we have to wash our hands. This is really important because today our focus is children. So we know children don't always do a great job of washing their hands. So we don't want you to not give children this step. They have to wear a mask over their nose and their mouth, washing their hands a lot, all the time, and staying apart from one another. This is what it looks like when your child is wearing a mask that is properly fitted. You see, it's over the nose and the mouth. So you can get it where it's just a regular surgical mask for kids, like this cute little girl with her cute little ponytails. You can get something like that or something that's a little bit more stylish for your teens. So, but whatever you get, make sure that it's over the nose and over the mouth. And it fits as tightly as possible. You don't want really a lot of air seeping in through the sides here or around here. You really want it to cover, okay? All right, as usual, we look at our data here in Alameda County. I want you to pay close attention right here to this number. So we know our total cases, we're at up to over 69,000 cases totally in Alameda County. That's a number of cases. I put this slide up every week, and every week you should see that the number is increasing. That's why we are continuing to talk about coronavirus. If our numbers were decreasing, wouldn't be any reason for us to continue to harp on the same story. But because our numbers are continually increasing, we have to say it over and over again, okay? 69,000 people have contracted coronavirus, and over 842 people have died from this disease. I want to go right down here to look at our ages, okay? Today, again, we're talking about kids, and we're talking about coronavirus in kids, and I want you to know, to date, our cases by age group less than 18 are 8,193. Okay, I want you to, I know that doesn't sound like a lot compared to 69,000 people, but I want you to think about this. Back in December, on the 30th of December, we were at 5,829 cases, 5,829 cases, December 30th. Today, January 21st, we're at 8,193 cases. That means over less than a month, there have been over 2,364 to be exact, because I did the math, 2,364 cases in the age group less than 18 in less than a month. Now, I'm going to sit here, let that sink in. Less than a month, an increase in 2,364 cases. What is that telling you? That is telling you that less than 18-year-olds are contracting coronavirus. And guess who those less than 18-year-olds are more than likely contracting coronavirus from? The person in the back, what'd you say? Adults. That's right. Yes, kids can get infected with coronavirus. Yes, kids can get very sick from coronavirus. Yes, kids can be hospitalized from coronavirus. And unfortunately, yes, kids can die from coronavirus. Adults, we have got to stop. We have got to stop the spread. We have got to protect our children. Our children are not going to receive the vaccine for a long time. Okay, they're just starting the trials. The people who are giving our children this disease are adults. Wearing the mask over the nose and the mouth, distancing, washing hands, keeping your butt at home. If you have not seen my TikTok song, you need to go and follow me on TikTok at my Dr. Donna and see my Keep Your Butt at Home song. I need y'all to keep your butts at home, okay? I want you to think on this. I want you to think on these things, okay? First of all, yes, you may have seen in the news that there are new strains of coronavirus. We know that viruses mutate. That's what they do. That is in their makeup, that's their code. They like to change. Why? Because they like to be alive just like you. And they start to change as they recognize that they're either being seen more, there's more things that will kill them. They're going to mutate. That's what they do. That's what coronavirus has already done. And we've seen it in the UK, in South Africa, and Brazil. We've seen it in many, many countries that this virus has mutated. Now, the new strains are supposed to be highly contagious. That means that they're easier to spread than the initial virus. Now, what does that mean? That means a lot when we look at the number of cases that for our children less than 18 in less than a month, over 2,000 cases. That means that whereas before, if you recall, coronavirus was thought to be just an adult and an older person's disease. We didn't think kids were going to get it. Studies that were in Europe and Asia showed that kids were really, really low risk when it came to their risk of spreading the virus from child to child. That's why schools were open in many, many parts of the world, and the other parts of the country opened up schools because of this low risk of child-to-child transmission, right? But now here we are with this strain that's increasing, possibly increasing its spread. That means it might be, and we don't know this for a fact, but this is what we're trying to get more information about. It might be easier for a child to spread the virus from child to child. That's where we are today, trying to figure it out. Adults are still the primary source of infection. And this is what's important for our kids. So many of us have allowed our kids to be in mini pods. So they are in their family, and then they might be in sports, or they might be in some other activity. And so your child is in this group and in that group and in another group. We have to stop that, people. We need to keep our kids into one group, because that's going to prevent the spread of the disease. Again, coronavirus is social. When you hang out, it hangs out, and it's like, woo, yeah, baby, let's go, let's hang out. But that's not what we want, right? We want to stop it from hanging out. So your kids need to be in one pod only, all right? So strongly consider that. If you have been allowing your child to participate in sports, travel sports, competitive sports, please consider stopping. And then finally, vaccination. That's going to decrease the spread, right? Because if I'm vaccinated, then I'm going to be less likely to actually get the disease. And then hopefully I'm also less likely to spread the disease, but that's yet to be seen. So it is important, can't say this enough, for adults to take care of yourselves in terms of how you spread the vaccine, the virus, because that is then going to determine how the children are infected. So I want to say this to you all. In quarantining, so many of us are hearing quarantine. What does that mean? I really want you to get this. If you have been exposed to someone who has coronavirus, you need to quarantine. There's nothing else left to say. If someone has testing positive for coronavirus and you've been around that person, that means you need to be away from everybody else. Now, we said initially 14 days. CDC realized people stressed out, couldn't do 14 days, and so we moved to 10 days. So if you don't have any symptoms after 10 days, you're okay to leave, to stop your quarantine. But if you have symptoms, runny nose, sniffly nose, cough, anything like that, then you need to stay in until you no longer have symptoms. If you are at work and you have been exposed at work, you're not supposed to go to work the next day, whether you have symptoms or not. Why? Because it takes some time for the virus to replicate enough in your body to have you cause symptoms. But in that meantime, you're chilling at work, you're talking to people, and you're potentially spreading it. You've been exposed to somebody you know is coronavirus positive. Keep your butt at home. Man, this song it could go to #1. Keep your butt at home. Quarantine away from everybody if you have been exposed to coronavirus. Or if you have coronavirus, stay home, right? Let's do an update on the vaccine. The vaccine is not rolling out like we wanted it to. We needed our vaccines. We need more, but we have some and we have enough. So if you think that you want to get on the waiting list to get the coronavirus vaccine, I did a show on this many times, so I'm not going to rehash that tonight. If you're interested in getting a vaccine, look at my show. We've talked about it multiple times. It is a personal choice that I want you to make for yourself and for your family. Should you choose to get the vaccine, you can sign up at the COVID website. It's covid19ca.gov. Go to that website, sign up and say, hey, I'm ready to get a vaccine when it's my turn. Okay. So I know I've given you a lot of information, but I want you to know that that's the best way to protect our kids is for us to do right, for us as the adults to protect ourselves, and that will help to protect our children. Thank you for watching another episode of Talking with Dr. Donna. I am here every Thursday to give you some information and to help to build our generational health. The next generation, our children, us, our older folks, we want them to be around and we want them to be healthy. Remember, let's go. Let's see me. I'm your favorite doctor, right? You always have an appointment with your doctor. So I'll see you soon. And if you have any questions, make sure to look at past videos on Talking with Dr. Donna. Have a great day.